views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to BronxTalk. Maybe the word disenfranchised is not strong enough when you described many in the growing lesbian, gay, bisexual, transgender, and queer communities in the Bronx. LGBTQ people often face violence and harassment. Often they've been thrown out of their homes and by their families. And also, too often they face an unsympathetic approach to their health care by practitioners who don't fully grasp their needs or how to properly treat them. Also, in our changing world, even with the new and effective HIV treatments available, for a variety of reasons, this population can be underserved. Add in that many of these and other factors lead to LGBTQ homelessness, and you've got a dangerous cauldron. Into the breach in the Bronx steps Bronx Lebanon Hospital and Project Renewal, who aim to directly address these issues. And they are with us tonight to talk about LGBTQ health and homelessness. If you have questions or comments about anything you heard on tonight's show or anything you hear on tonight's show, send an email to us at BronxTalk@BronxNet.org or post them on our Facebook page or send us a tweet to @BronxTalk, and we'll read them on the air during a future edition of our program. For the here and now the chair of the Department of Family Medicine at Bronx Lebanon, Dr. Douglas Reach. Good evening. Thank you for joining us.
Good evening, Gary. Thank you.
And the CEO of Project Renewal, it is Mitchell Netburn. Mr. Netburn, thank you for joining us.
Thank you very much for having me.
Dr. Reach, let's start with you. I am come to understand there is a transgender clinic at Bronx Lebanon. I also have come to understand it was the first in the Bronx 6 years ago. Talk to me about what it is and what the need was that inspired you and your colleagues to set it up.
Absolutely. Again, thanks a lot, Gary, for having me this evening. And in fact, it was the community that drove us in the Department of Family Medicine at Bronx Lebanon to actually develop our transgender clinic. And it was as family physicians, we reached out into the community to look for and identify the needs that existed in the community, and came across some community-based organizations, and in particular, Community Kinship Life, CK Life, which is community-based and really connected with the transgender population and people that live in the Bronx, not only in the Bronx, but throughout New York City. In conversations with that organization and with others, as well as some local politicians, we absolutely recognized that, and you used the word disenfranchised, that the transgender population 6-7 years ago was disconnected from quality health care and continuity in health care. So as family physicians, we realized this was a need that we needed to serve, and we opened probably the first transgender clinic here in the Bronx.
Do you have a sense of the numbers? How many people, well, certainly you know how many you serve, but how many people are out there that you would like to serve or kind of assess the size of the need?
Well, it's a great question, and in actuality, our clinic to date has served over 500 individuals. We have over 350 who are coming to our clinic, to our transgender clinic on a regular basis to receive services. But to respond specifically to your question, we really don't know. And the reason is there are thousands in New York City. The reason we're not exactly sure of those numbers is because some folks still haven't made the decision that they're going to go through transitions in their life. So you still have many people out there that aren't certain.
You know, I want to just kind of recapture what I said at the beginning, and you've already referred to it, the idea of disenfranchised. When somebody is the subject of or object of violence, when somebody has been thrown out of their home by their families because of who they are or who they perceive themselves to be, that to me goes a little further than disenfranchised. It's directly persecuted. That's my editorial comment, folks. Talk to me, though, about you know, specifically what services you have developed and what do you do there, and then we'll connect it up to the great work that Mr. Netburn is doing.
Absolutely. Well, let me just touch briefly on your editorializing here. Indeed, we have heard all kinds of stories, some really quite dramatic, as you described, individuals who are asked to leave their family or their home, or lived in other parts of the United States, and in order to escape came to New York, which is a much more friendly community as it applies to the transgender population. So we've seen that. On the other hand, we've also seen some very touching stories where families embrace their family members who are going through the transition. So we've seen a wide variety of stories. All of them really do tug at your heartstrings.
So now let's just get to just a couple of items of, you know, categories of things that you do and conditions that you address.
Absolutely. So in provision of care for the transgender patient, we provide comprehensive medical services, meaning we provide primary care. We look at healthcare maintenance and preventive medicine. So they get flu shots like everyone else. We make sure that they get the appropriate tests for cancer screening, such as colon cancer screening or cervical cancer screening, as an example. We screen for HIV, hepatitis C, and other diseases.
I want to just interject, and then I do want to bring Mr. Netburn into the conversation. You know, I can get those services. You can get, other people can get those services. Why do we need a special clinic for those people?
Great question, and I truly appreciate it. And the reason I say that is because the transgender community historically have gone to marginally health clinics or health centers that are on the margins because of their fear and concerns of moving into the mainstream, and also the way they were treated historically. In
simple
Yes,
prejudice.
exactly.
Mr. Netburn, this announcement that came from Project Renewal I view as somewhat historic. I mean, it was very important to have this new facility that is about to open in the Bronx, as I understand. So why don't you, same kind of questions, but from your angle, why did we need an LGBTQ homeless facility, I guess shelter is the word, in the borough of the Bronx?
It's estimated that 40% of all homeless youth are from the LGBTQ community, you know, so they're tremendous numbers.
And you don't believe that that's coincidence, probably for some of the same reasons that we've already talked about?
Absolutely, all the same things, you know, outright discrimination and, you know, sometimes being asked to leave homes and sometimes literally being thrown out. When people get into their 20s, the youth shelters, they're too old for that. And currently there really is no specific place for those people to go. So this is the first shelter in the entire city of New York that's going to be dedicated to members of the LGBTQ community in their 20s. It really is historic. I worked at the New York City Department of Homeless Services about 17 years ago. This issue was raised then. It's been talked about for literally decades, and it's so exciting that it's actually happening.
I'm going to ask you, in essence, the same kinds of questions. So, I mean, we have a huge homeless shelter system. I'm not going to evaluate it here on this television program, but explain to me why we would need something that's dedicated for LGBT folks.
Sure. So Project Renewal's mission is to empower homeless people to obtain health, homes, and jobs. There's unique needs of members of that community. So they need very specific services. They've been marginalized. They haven't received the services they've needed. Sometimes outright discrimination. They'll go to certain facilities and be turned away. And so what we want to do is make sure that either we provide the services or work with groups like Dr. Reach's to get them services that will know their unique needs, be totally sensitive to them, and very welcoming.
I don't know if you can do this, but based on just listening to what both of you say, as much as the specific problem is, health deficiencies of some sort or health needs, and as much as certainly I think it was George Carlin who called it houselessness instead of homelessness, what percentage or how can you characterize the psychological issue that you have to deal with in the context of the very specific fact that somebody may need a place to live and also may need a job and training and things like that?
Sure.
It sounds to me like that issue of being discriminated against seems to feed all those other issues.
Absolutely, and that's why facilities
Is there a
needed.
percentage? Could you say 80% of it, or it's not fair to do that?
It's not really fair, but I can foresee that virtually all of the clients that are going to come to this facility are going to face discrimination either in healthcare, either in housing, from their families, in school, applying for jobs, working in jobs. Somebody saw them on the street. And so to really break that cycle of homelessness, you need to really address all of those different issues, and that's what this center is about.
Psychologists, psychiatrists on board?
We will have psychiatrists on staff, medical staff there, case managers, people dealing with substance use disorder issues, employment issues. We're very excited about that because it's a young population. They've got their whole life in front of them. If we can just give them the tools to live as fully and independently as possible.
Same question for you. Percentage-wise, how much of what you do is really about this, and not necessarily that there's something wrong with them, but something wrong with the rest of us that have put them, in some cases, in this position?
Oh, that's the reason why they are in
Why we need
unstable
to do this.
housing. I would add, from looking at it from the health perspective, what we've noticed is the number one inhibiting factor for individuals to get the LGBTQ community to get ongoing health care is unstable housing, whether it's frank homelessness or being bounced from a friend's house to a family member's and just bouncing around. So the opportunity to have stable housing for young people is fantastic. They then will access not only health, but additional education, job training, et cetera. Just the beat goes on.
So then here on Bronx Talk, I can say, Dr. Reese, this is Mitchell Netburn, because basically, really, there is an interrelatedness. And I want to ask an interrelated question then about funding. And it may be a horrible thing to have to ask. Did you have to come up with additional funding to open a center like this? Or is this just part of, you're delivering another service and Bronx Lebanon has the resources to deliver services? Or did it have to be one of those things where we applied and then somebody out there says yes? And attached to that would be my concern that maybe funding, the way the climate is, might dry up at this point.
Well, we actually started the clinic on a shoestring, so to speak, so that we didn't ask for the institution or any private or public funding to develop this program. We recognized the need. We started small. We trained a few doctors, and we've continued to expand that. And not only do we have physicians involved, we have mental health providers, behavioralists, social workers, psychiatrists, the same psychologists. Very, very important.
It's coming to you too.
And I was going to say,
so to open, we talked about it being an historic moment that we're getting this in the Bronx, but I would want to know that if we're going to do this, we're here for a while, and we're going to establish it for the people who need it.
Sure, absolutely. We're incredibly fortunate. This shelter has the full support of Mayor de Blasio's administration and also the local city council member.
Richie Torres.
Richie Torres has been, he couldn't be more supportive. He has been absolutely phenomenal. He wants the shelter in his district, so we've worked very closely with him in his office. And so, we're fortunate that we applied to operate this facility. The funding is there from New York City, which houses over 60,000 homeless people a night, and finally is opening this specific shelter.
I'm going to throw a thorn in there that's also in between. So one of the issues that I understand from the healthcare community is that if somebody is in the shelter system, whether it be in your facility or not, they don't always have access to health care. How do you bridge that gap so that some of these very fundamental needs can happen even though somebody might be going through the system.
So one of it is having some of the services on site. For some people, they're dealing with so many challenges at once. I mean, just imagine the psychological effect of being thrown out of your home by your own family,
It's horrible.
and then just that's not an isolated, and then it's on the street and in school and on and on. So sometimes,
excuse me, and I just want to articulate it for people who don't fully grasp it. It's everywhere you go. You go in the store and
Exactly.
somebody may look at you, and then maybe a guy standing online will say something nasty, and you want to ignore them and you just move on. But it's just this constant thing, and I personally have tremendous empathy for it.
Absolutely. And so some of the services need to be on site. So while they're dealing with all those stresses, till you stabilize them and they see that people are really caring, that's important. Then having linkages, again, with programs like Dr. Reaches and others. They may come from a certain community, they want to go back there. And so you have to make that easy. Sometimes just some of the basics of transportation, how you get from point A to point B. Knowing if they're an hour late, they're still going to see you. Those things are important because once they're turned away, they're not going to go back.
People watching now on TV and maybe on the computer, whatever. The one major thing we didn't say is where is it going to be? How do people get in? And now I want to move to the HIV question, which I know is something else that's important to this and even in general. So
it's going to be in the Bathgate section of the Bronx. And
is that an address we want to put out?
not an address for some of the reasons we just talked about, but
very interesting.
It's in
very
that,
sad,
it's in that area, and they can either contact Project Renewal directly if they are attached with an organization. That organization call us; they can call them ourselves, and also the New York City Department of Homeless Services. 311 is also a great
way to do it, and ask about Project Renewal. Say you saw it on BronxTalk, of course. Is there a financial issue involved? I mean, or is it part of the city's shelter system?
This is just part of the city shelter system, but I think the city's moving towards creating shelters that really can better meet the needs of the tremendous variety of needs that all the homeless people have, and this is one of the first that they're doing for a very specific group.
Dr. Reach, we have all heard in the news and all the talk now, and in fact I saw some people speculating, have we seen the last of HIV and AIDS, which of course we would all love. I hardly believe that to be true. Talk to me about where we are at in general in treating HIV, and then of course why this particular population has a specific need that you are trying to address.
Well, as HIV goes across the nation, the actual new cases has hit a plateau and started to decrease, which is a wonderful thing. People have taken to heart the education that has been provided out there, and that is you need to use appropriate protection, and there are also medications that can assist you. But unfortunately, in the Bronx, we continue to see new cases evolving on a daily basis. And to make matters even worse, we have a percentage of the population here in the Bronx who are HIV positive. They know so, but they're not, unfortunately, they're not accessing or obtaining ongoing and consistent care, and therefore their viral load, which is a marker for how they're doing with their disease, is not suppressed. So we continue to struggle here in the Bronx. Funding is coming in from the state, the city, the federal government in order to support efforts. One of the issues that we do have in the Bronx is to have coordinated care, and so for those, whether we're providing shelter services, health care, or other social services to patients that are living with AIDS, living with HIV, I beg your pardon, we need to be able to coordinate those services, and
well, that's why I brought you two together.
Exactly.
It's working. Yeah,
Coordination is critical. I think the entire field of medicine is understood. There's a psychological component to it. You just can't give somebody a prescription, go fill it. They don't feel good about themselves, they're not going to fill it. If they don't have benefits, they may not have the money. And so again, it really is, you've got to have this comprehensive approach. Not only see a doctor, but work with your counselor, understand why you need to take this medicine, have positive feelings about yourself, you want to improve yourself. If you don't have benefits, get somebody on benefits quickly, that's critical. That'll be provided at this shelter.
This again goes back to the same question that I asked earlier about what percentage of it is the mental and emotional state that folks find themselves in as a result of, the situation they're in and the prejudice that they've had. I'm guessing also fear of care. You must see it often, or you will see it certainly when you, open that center, is that you're going to say, well, go do it, and then there's going to be a lot of hesitation to say, you know what, I've been down the road with these doctors, they don't listen to me anyway, I don't even want to admit certain situations maybe that I've been in, all those kinds of things.
It really comes down to trust, and that's one of the things you've got to do from the beginning is build up that trust, show that you really care, respect everybody that, and we do this, respect everybody that comes through our door. There's a human being, and different people get it right away, and other people it takes a while because they've really learned as survival not to trust people, and we understand that. So we build that trust, and then finally the light bulb goes off, and they're like, "Oh, you really care," and that's so warming to our hearts. And we don't say, "Yeah, we told you so." It's like, "Great, we're here. What do you need? What can we do to help you?"
I hear what you're saying, and the whole idea of trust, and you have a significant amount, I mean Project Renewal, significant amount of experience in this realm. This is not the first center that you've opened. It may be the first LGBTQ center, certainly in the Bronx. Talk to me about what you and the organization has learned from other things that you've done that are going to be applied here and maybe even extended given the specific nature of the population.
You're right. Next year will be our 50th anniversary, so we've been doing this for about half a century. We are particularly excited about this, and as you said, for those lessons. So we have served this population for decades. They're in our other shelters. But one of the things we're excited about here is every homeless person is different, just like everybody else, and they really need tailored services. And sometimes in the larger shelter system, it's a little hard to really give that individual treatment that each person needs.
I'm sorry, I'm only reacting to the word, it's a little hard. We've got only 70,000 people in the system. Yes.
And
make that point.
And so one of the things we're excited about this shelter is because it's focused on the LGBTQ population, and the city understands that their needs are a little different. We're going to have a little more flexibility to really tailor those services and work with partners throughout the Bronx and throughout the city to give the individualized treatments. That's one of the things we've learned is there's no cookie cutter approach. You've got to treat each person individually, figure out what their needs are, what their issues are, and what is the best path to get them success.
Tailor-made staff, people who are going to be trained specifically or have been trained in this?
Absolutely.
He's shaking his head next, but he's getting the same question.
Absolutely. That's been a key with all the staff we've hired. We're going to open in January, and not only we're hiring people who understand the issues, but we're going to do very specific and ongoing training.
Let's talk about doctors.
Well,
I know it's really important. And, while some doctors may even mentally say, well, okay, I fully understand, but maybe their habits and the way they speak to patients are not. Talk to me about what you do to develop doctors who can address these folks in a respectful way that they deserve.
Yep. It was an eye-opener for us in many ways. Physicians go into medicine, they go to medical school because they're empathetic, they have compassion for people, they have passion for medicine, and yet here you go and you do all of that training, and then you go out into practice and
use a pronoun that maybe you ought not to use to the wrong person.
Correct. There you go.
Unintentionally.
Yep, absolutely. And it can be so powerful in a negative way. So what we did, and we continue to do it with our medical students, our residents, and our attending physicians, as well as the rest of our staff, which sounds like Project Renewal is doing that also, and that is we have ongoing training, and you bring people in who are experts in the field, and who have who may live that life or have lived it, and they then can educate you.
And you do that?
Absolutely, on a very regular basis. And I would say not only with the transgender, but this applies also to people from other cultures, from other religions, ethnicities. So you always have to be conscious and cognizant of this as you're practicing. And training, it requires training.
And the peer training, as you're saying,
Peer
training is so critical because somebody who's lived that experience, they can relate. And not only having peers do training, but peers, actually providing services. Somebody can say, I've been there, I know what you're going through, and sometimes certain people will relate better to that, understandably.
Dr. Reach, I want to just get back to you about something. The last time you were on the show was about the Claremont Healthy Village Initiative. And it seems like a strange question to ask the director of a large department of family medicine. In a way, the same thing that I asked Mr. Netburn. I'm guessing this was you mentioned at the top of the show of how you developed this and why you developed this, but I'm guessing for you as a physician, this has been a bit of an education to go through it and then say, well, we can't do top down, these are the services we want to provide, we have to hear what a community says. Talk to me about even your own growth as a physician and what you have learned from watching my friends and neighbors in the Bronx.
Right. Well, I keep using the term eye-opening, and in fact, as we go through life and as we keep our mind open and receptive, each and every day is a learning experience. And with the transgender community and population that we served, it was absolutely that. We've learned to be sensitive, not only to
Got a minute left, so I want to make sure we also find out how people can access your
absolutely. So not only did we learn things from the transgender, but from people from all walks of life as they come into our clinics.
And so for somebody who's watching the show and says, you know what, I got to get involved because I don't want to be unhealthy and I want to access the best services, how do they get to you?
Call 718-99-BRONX and ask
Easy
for,
enough.
there you go, and ask for family medicine, and we'll get you streamlined right into the right place.
718-99-BRONX. Is the clinic open every day?
Every day, 6 days a week through Saturday,
Wow.
3 evenings also.
Tremendous, tremendous. Thank you so much for the great work you and your our friends at Bronx Lebanon are doing. Same question for you. You mentioned it earlier, but I want to pump it out there. There's no reason to be alone, I think, is the thing. And there may be a place that you can go that will take care of you.
Yeah, there is. We'll have beds for 80 people, and we can't wait to fill that up. And really to create this as a model for not only the city, but frankly the nation.
Call 311, ask for Project Renewal. Look them up on the web. You'll find out how to get in. Thank you, gentlemen. Mitchell Netburn, Dr. Douglas Reach, you are saving the world, and we appreciate you doing that here in the Bronx.
Thank you very much.
Folks, if you have questions or comments on anything you heard on tonight's show or anything going on in the Bronx, email them to us at BronxTalk@BronxNet.org. You can put them on our Facebook page, or you can tweet them to us at BronxTalk, and we'll read them on the air during a future edition of our program. We ask you to like Bronx Talk on Facebook. Our archives are at BronxNet.org. You find Bronx Talk on the lower right navigation bar. Next week, totally different show. We'll be joined by the City Controller. Scott Stringer will be here. So thank you to our producer, Jayla Juberis, and to Brianna Roller, and who's our director. And guess what? All the cast of thousands, and to you and to them. We'll see you next week.
Don't wait. Communicate. Make your emergency plan today.